So today's guest is not a stranger to me because I met her when I was doing my rotation in Cleveland this year in January. So this is the reason why I tell everyone that you have to make contacts and you have to talk to people, and who God knows who might help you in recommending for your particular program, and even giving you the most amazing tips, and maybe later on becoming your study partner or accountability partners. So yeah, it's been amazing talking to the new people, making friends, and seeing a journey of everybody else, because everybody's story is so interesting and it is so amazing to see how everyone is so resilient and they fail and then they get up and they try again, and everyone is having those kinds of insecurities that we usually have. How are you?
Hi Kavita, thank you for doing this.
Oh, thank you for coming. Sure, so many students are gonna learn from you today. So I was just telling everybody that we actually met in Cleveland this year. So it's not like we are strangers. So
Yeah.
I was just telling them that it's
Actually,
so
we've
good.
kept in contact even after that. Maybe like it wasn't that frequent, but we were still in contact all the time.
Right, right. That's what I was talking about. It is so important to build contacts, and it is not easy, in the beginning to talk to strangers. But I think we have to work more on our communication skills and build the community around us. So, yeah.
I think you're very good at it. I mean, the first time I met Kavita, she was this light of positivity. The way you see her on Instagram, that's it. Maybe prettier, but that's the truth. She's phenomenal.
Thank you so much. Thank you so much. Okay, so with the first question, like without any further time, let's start with the first question.
Yeah, sure.
So, how much gap did you take between step 1 and step 2 exam? From the ending of step 1 exam to the starting of step 2 preparation, and what should be the right strategy according to you?
Okay, so I will answer these questions in every scenario. The thing about step 2 is, even if you take a gap, I assure you, you can score well. I did not take, I had about 6 months gap. Have a lot of gap, but I would say that there are people who take a lot of gap and still like score well. So I would like assure you that if you think, oh, I had a lot of gap, it's been a year, it's been 2 years, I don't think that's a very big issue. Regarding this, I would still say that the main problem that I had with the exam was I was very short on time. You know that very well, that I did it like so quickly, and and I think the only thing that really helped me was that I looked at nobody else's plate. I focused on myself and I thought, oh, these are 5,000 questions. I need to get these done in 2 months, 3 months. I got them done. But I did it like in 4 or 5 months, and I think that's sufficient time to score in 250s at least. A couple of more months and you can probably add some more stuff, which I can discuss about, and you can score in 260s. And I believe like this is completely strategic. I did this and I saw other people do other things, and it like, I would say this is like a completely strategic way to do things.
Okay.
So I don't think like, even if you are scared, you have had time, you did a research job, or you gave it during your internship, or you gave it during your second year, and now you're gonna give your step 2. I would say I don't think you need to worry. It definitely helps, I'm not gonna lie, but you don't need to worry that you can't. I'm damn sure that you don't need to worry.
Yeah, because everybody thinks that immediately after step 1, everybody says that we have to start step 2 before we, forget the step 1 concepts. And for so many people, it doesn't happen that way in that sequence. So we become so tense that we might have forgotten everything, and now we will have to work our ass off to get to the step 1 basics, and then work for step 2.
Even if your step 1 bases are very clear, you still have to work your ass off. There is no rhyme or reason to it. Like, it's the truth. Someone wants to sugarcoat it, but this is the truth. You have to work your ass off. There's no other way.
Right. Okay, that is good to know. Okay. So I think in some way it answers our second question is does the step 1 knowledge help in step 2 preparation, and if yes, how much and in
So
what subject?
I think you would say these are such dubious answers, but you know for a fact that, like, because I did the first aid and everything, it helped me with my step 1 knowledge a lot. I would say it does help, but I have honestly seen people who didn't do very well on their step 1 and still did well on their step 2. And I'm pretty sure there are those kind of people around you as well. I don't think I would say that you should never leave any stone unturned. That was my philosophy in life always. But I would still say that somehow you missed the mark. It's okay. Don't beat yourself up. You still have another exam to prove yourself. I see people all the time who have like attempts and still match. So, it's life. Things happen. I think you should focus on your personal story. If you couldn't build a good step 1 base, shake it off. Go and build a good step 2 base. Why can't you do that? But see, this is coming from someone who had a good step 1 base. So I would still take everything that everyone says with a pinch of salt. But I have seen people with a bad step 1 base do very well on, much better than me on step 2. So I would say you should shake things off rather than sit with it and internalize your failure. Never do that. That is what is stopping you rather than anything else.
Right. Because sometimes we get too obsessed with the step 1 exams, and our whole strategy for step 2 is totally biased according to our previous performance. Yeah, that was very good point of view. Okay. Now, actually, the most important question of the whole life is what are the resources for step 2? Like everybody wants to know that.
Okay, so I will tell you what I did, but I will give you advice what you should do instead. Because I would want everyone to score even better than I did. So I used UWorld. I used UWorld and I used some of the Divine, and that's it. I did not use any Amboss. I made my own Anki deck and I did not use it, but some juniors are using my Anki deck now. It's only 4,000 cards. I'll release it to you.
Wow.
I don't think it helps using someone else's Anki deck, but if you need it, sure, why not? I made my own Anki deck which I didn't use. So here's the time sync that I did. Don't do that. If you're gonna use Anki, use a pre-made deck. Because I made 4,000 cards and I only had 4-5 months. How was I even gonna mature them? It makes no sense. So don't do that. You should have sufficient amount of time to use Anki. UWorld, how I did was, I would do 3 blocks a day minimum, and I did not do them timed, but I'd never had a timing issue. If you have a timing issue, do them timed. It goes both ways. Again, it goes both ways. Some people have a timing issue, do them timed. If you don't have a timing issue, you are like me, do them untimed, because when I did them timed, I could only do 2.5 blocks a day, and I wanted to get this done. So I wanted to do 3 blocks a day, so I did them untimed, because untimed took less time for me than timed. So this was my strategy, but it might not work for you. You have to see what works for you, which makes a lot of sense. Some people are good at timing, some people are good at concepts. You need to see what you are good at. I saw I was good at timing, I made the best use out of it and completed the UWorld in 3 months. So if you're good at concept, you should work on your timing. I was a little not that good at other things, but good at timing, so I worked on other things. This is one thing you should take from it. I don't think you need Amboss to score a 250, 260. I didn't use it, but some people did and they still ended up in 240s. Some people did and they still ended up in 260s. So it goes either ways, but there are people who don't use it and still end up doing well. UWorld I did first pass, and then second pass I would do alongside CMS forms. I know everyone has questions about CMS forms. Here's what I would make out of it. CMS forms are concepts that are missing in UWorld as well as Amboss. You will find concepts there which are missing. At least I found those missing. Just make a note of those concepts. Number 2, the NBME wording is very different for step 2. and it is very different from UWorld, and it is kind of tough to get used to. It was for me. CMS forms help you accommodate to it. Then there is another question that how many wrongs would you get? I would tell you, do not at all look at anyone who's getting, like, even if out of the 50 questions you are getting 30 wrong, don't look at anyone who's getting like less questions wrong than you, because we had like so much variations. So I had I was studying with a couple of people. We had so much variations. I would get extra wrong in some topics and I would get less wrong in other topics. It was so much variations. What matters is how much you're learning from it. Same goes for UWorld percentage. My UWorld percentage was in the pits, but it doesn't matter. I learned from it. And same goes for you. Yeah, UWorld percentage can be very good, but you can perform badly, and it can be very bad and you can perform well. You need to learn from it. Your main goal is, who's seeing your UWorld percentage? Only you. It is to learn from it. So don't get disheartened. Don't go online and ask people ki meri UWorld percentage itni hai, what should I do? It doesn't matter. Are you picking up stuff from it? That matters the most.
Just like you talked about CMS forms, so after you finish your UWorld completely, you started your incorrect of UWorld along with UC.
No, so I didn't start. Okay, I know what you're trying to ask. Do you want me to answer it?
Yeah.
So UWorld, which I did not complete, I left like 200 questions and I reset it.
Okay.
Because you believe you know your corrects, but you really don't know your corrects.
Right.
And this is the God's honest truth. You believe you know your corrects, but you don't know your corrects, honestly. So, uske baad, I really thought, yaar, I can do 3 blocks right now. I can do 4 blocks then. But 3 blocks se zyada kabhi nahi badh paya. On a very, very good day, when I did not pick up my phone, I could do 4 blocks. But that's me. Probably you are better than me, which is great. I did only 50% decent. उसमें मेरी परसेंटेज, पहली बार मेरी परसेंटेज थी अबाउट 64%. उसमें मेरी परसेंटेज थी 80%, 50% रीसेट में. मुझे एक भी क्वेश्चन याद नहीं था. लोगों को होता होगा, मुझे नहीं था. So it worked for me. Maybe you are the kind of person who does not need it. You need to see it for yourself. But this is exactly what I did. And then साथ में I was doing CMS forms, and I would do 3 CMS forms a day or 2 CMS forms a day sometimes. And if I was having a bad day, 1, but that was very rare. 2 to 3 CMS forms a day I would do, but I still couldn't complete all the CMS forms. Mera surgery ka I didn't do, emergency medicine ka I didn't do. I would say neuro and psychiatry and internal medicine don't miss. OBGYN depends. If your OBGYN is weak, then you should do it. But if your OBGYN is not weak, I don't think it really helped me. Pediatrics, mine was weak, I did it. Again, it's so personalized. You need to see it for yourself. So, जब ये सब कुछ हुआ, you need to keep changing your strategy and don't listen. You see, अगर तुम AMBOSS करने बैठ जाओ और तुम्हारा AMBOSS ही नहीं खत्म हो रहा, तुम्हारा triad pass में आ रहा, how are gonna things work out? क्योंकि then there are 6 NBMEs. And एक NBME revise. Oh, I need to talk about this. There are 6 NBMEs. एक NBME देने में एक दिन सुबह, and then I would do 1 block if I had the energy उसके बाद. एक NBME को revise करने में मेरे को 2 दिन लगते थे, because I would look at the question, I would see why I did this mistake. I would revise that complete concept again. So, for example, I got the concept wrong कि aortic stenosis में we have to change the valves. कहाँ करना है, कहाँ नहीं करना है, मेरे को भूल गया. I got it wrong, है ना? I would go back. I would find that UWorld table in my Anki deck, or probably there is. You can note this down. There is UWorld tables in Telegram. They just have UWorld tables. So, and you can just search it. You can just search aortic stenosis, and that table comes up. So I used that, and that was so much easier for me. I didn't have to search any notes.
Wow. So the channel name is UWorld tables.
I'll share it with you. You can put it on your you can put it on the channel. I would just search उसका table आ जाता था. I didn't have to read everything. वो table I would learn. So this way I revised my NBMEs. So that is why I was able to do it in such a short period of time, because I did quick and easy, but still the concept has to be there. And तुम मानोगी नहीं कि I got a very basic bread. Okay, so coming out of the exam, I remembered 150 questions. because I'm neurotic that way. And I knew the questions I had missed, and I had a range of marks I was gonna score it. I knew I was not gonna score my highest mark, but I knew I was not gonna like go below my range also, because I had estimated what was gonna happen. So when this happened, 2 weeks were like hell for me. When these 2 weeks were like hell for me, because I knew what had happened, right? Because I had not slept, I missed very bread and butter stuff जो 90% यू वर्ल्ड में लोगों के सही होंगे, मेरा गलत था वो फाइनल एग्जाम में. And I still scored okay. So don't worry about the exam. Like I went through hell and I came back, and every day I would ask my mom, Dad, am I gonna pass even? And my parents would be like, just shut up. We can't talk to you anymore. They were so tired of me. They were like, we can't talk to you anymore.
Oh my god.
Like, they were like 3 महीने हो गए. We are just like, तुम्हारा एग्जाम ही पता नहीं क्या हो गया. And when the result was out, they were like, we are so disappointed that you didn't fail because we went through hell with you. They were just, making fun of me. Yeah.
Yeah, that happens. But just like you told that you used to do 2 to 3 CMS forms per day. So ideally, how much percentage should a candidate aspire to do before exam?
Don't get anything more than like 12 to 15 questions wrong. I think that will put you in a good 240 score, because you will learn from them also, no? Because
Right.
the worst I was doing was 12.
Okay, got it.
And the best I was doing was 5 or 6. So you can just...
So that is what is
this is perfect. Yeah.
Okay.
So anyone I think who's scoring in 260s maybe is doing 5 or 6 in more forms. Or maybe they're revising it. I didn't revise anything. So that was my mistake. So learn from my mistakes, है ना? क्योंकि मुझे जो ये Telegram channel है बहुत late मिला in the last month. If I would have known this before, I would have made 0 Anki, and I would have just searched that channel. So someone asked, doctors, when did you give the step 1 exam? What time is ideal? So I gave it during the after my internship. I would say now, since it is pass and fail, you can give it whenever. But I would still say that you should know I forget. I think you should still know your first aid through and through. There are a couple of topics from first aid I would tell you to read before your exam, which I did, and they helped a lot. Immunodeficiency diseases, know them through and through, and there is not a better resource than the first aid for immunodeficiency diseases. Then for drugs, I would still go back to my first aid, because I always did the drugs from first aid. And micro also, I just flipped through it while we were traveling. So जब we were traveling, because we had to go to Delhi, right? So Patiala से Delhi, it takes some time. So while we were traveling, I flipped through my first aid quickly. And then I did also, anyone who's in there dedicated, this is something you should do. I did ethics from Amboss, ethics from that, and I got a lot of questions right. I did screening and vaccinations from Divine. I made a deck for it. You can take my deck. Anyone can use it. As you know, I have repeatedly said I didn't do my own decks, but it is a good deck, honestly. And they grabbed me a lot of marks. And I would say, sometimes first aid has better explanations than UWorld. I feel that. There was one. So whatever update, there were a couple of updates in the first aid, which I got in my exam. And I only knew because I was there, in that editor's thing. And I knew there was updates कि ये चीजें बदली हैं. So there was one question, which I think is probably an experimental question. But I only got it right because no one else would have gotten it right unless they read the first aid. Or unless they're a gastroenterologist. वो इतनी डिटेल में था. तो maybe the updates, क्योंकि एक PDF release होती है, the updates of first aid. I think you should do that. Instead, वो सिर्फ 2 पेजों की PDF होती है. You should just go through it. It takes 5 minutes.
When we were talking about resources, so just to recap that UWorld is going to be our standard resource, then the CMS Divine podcast and the CMS.
Yeah. So, and only 2-3 topics from Amboss library in the last few days.
That were immunology that you said?
No, immunology was the first aid. मैं बताती हूँ, ethics है, And drug and safety, there's something called drug and safety, where it is like कि जैसे तुम्हें मतलब not तुम्हें, a person has H influenza, how are you gonna, what kind of safety are you gonna wear? तो मतलब it really helps, मतलब क्योंकि तुम भूल जाते हो. So this is something I've shared like with everyone. हम डिनर कर रहे थे, there is a UL table from this जो मैंने टेलीग्राम से निकाला था, and I remembered I have to do this. I was just telling my mom कि इसमें से क्वेश्चन आएगा. My mom is like, okay, खाना खाते खाते we did that table. My parents are doctors, so we did that table. And उसमें से 3 क्वेश्चन आए थे एग्जाम. So do that table. That table is drug and safety. उसमें सेफ्टी जो है वो ऐसे जैसे नाइसीरिया मेनिंजाइटिस है तो तुम्हें किसी को मतलब आइसोलेट कर देना है, रिफैम्पिसिन खानी है, ये सब कुछ. जस्ट डू दैट टेबल. दैट टेबल इज काइंड ऑफ टफ इफ यू कांट डू इट. जैसे मेरे जैसा बच्चा हूँ कुडंट रिमेम्बर इट, तो मैंने वो लास्ट डे देख के गई. इट हेल्प मी एंड मुझे पता था ये करना है. तो देयर आर लाइक 4 टॉपिक्स आई टेल यू. एथिक्स है, ड्रग्स एंड सेफ्टी है, पीपल डू बायोस्टैट्स, बट मेरी बायोस्टैट वाज नॉट द बेस्ट, बट इट वाज नॉट वीक, सो आई जस्ट वेंट विद इट एंड इट वाज फाइन. मतलब easy आई थी, but it might be like, you know, your mileage might vary on this. People do biostats from Ambos. That's up to you.
And are there any good YouTube channels just like for step 1? We have so many. So did you watch any YouTube channel for say for step 1?
There is Dr. Hild. If you need like rapid, concise revision, he does it really well. And since his videos are older, I would go through their comments क्योंकि जो भी चीजें change हुई हैं, since people are so neurotic, वो वही नीचे डाल देते हैं. It helps. It really helps. It helped me. And there was always कि 45 years हो गई है colon cancer की स्क्रीनिंग, इस पे क्वेश्चन आएगा. अगर कुछ चेंज हुआ है उस पे क्वेश्चन, एंड NBME knows उस पे क्वेश्चन आएगा. जस्ट रिमेम्बर इट. तो वो जो भी नीचे कमेंट्स पड़े होते हैं, पहले 10 कमेंट्स में तुम्हें पता चल जाएगा whatever things have changed. Dr. Hild is good. I did not have a lot of time, तो you can either do Dr. Hild or Divine, क्योंकि these are so many resources. 5000 क्वेश्चन यू वर्ल्ड का करना is a tough game, honestly.
Right.
You can't do that. You can't go on learning one crazy concept which might not even show up on your exam.
Right.
Don't do this. Understand कि syllabus cover करना है, उसको ढंग से cover करना है. I'm not saying कि ढंग से मत cover करो, but तुम्हें एक टॉपिक में से 320 क्वेश्चन नहीं आना है. तुम्हें पूरे यू वर्ल्ड में से 5000 क्वेश्चन में से 320 क्वेश्चन आते. So you need to like understand this idea कि मुझे करना है, ढंग से करना है. I am not gonna remember everything, which is okay, but I'm gonna like make the best of what I can remember. Build on it. Do it multiple times. I think revision helps. I didn't have the time to do it, but revision really helps. If you have the time to do it, please go to the Telegram channel and मतलब जैसे मैंने कहा that really helped me कि मैंने जैसे aortic stenosis, उसमें aortic stenosis टाइप किया. I'll just share the channel with you. उसके बाद you can post it. वो मतलब that really helped me, क्योंकि मुझे कुछ भी ढूंढना होता था, cholangitis ढूंढना है ना, नहीं समझ आ रहा है, तो मतलब वहां मैंने cholangitis टाइप किया, मुझे वो UL table सा निकल आया. And they have that UL diagrams also. They have like about 3000 images or 4000 images, which I think is sufficient. अगर तुम्हें वो भी याद है, you can score so well.
So one thing that I would ask you is, suppose you are doing the world first block of the day, and you get stuck on one question, like you didn't understand that concept, or you think that you need something additional apart from the explanation. So how did you like follow?
I have like good insight on this, and I would tell you guys not to do this. I'm just telling you all the mistakes I did. You guys are gonna think so badly of me, but it's fine. Like please learn. Think whatever you want, learn from what I did. तो देखो जैसे 3 ब्लॉक करती थी, तो जैसे पहले ब्लॉक में 5-6 क्वेश्चन अटक गए कि मुझे पता है मुझे कार्डियो की ये ECG पढ़नी नहीं आती. I think I might have that copy also. मैं क्या करती थी, इस ब्लॉक में 70% आए, क्वेश्चन 6, क्वेश्चन 16 मेरे से नहीं सॉल्व हुआ, नेक्स्ट ब्लॉक करो, क्योंकि सिलेबस भी कवर करना है. लिख लिया, रात को डिनर करने के बाद I wouldn't sleep. I would go back and see these questions. कभी-कभी I would just search these questions. Sometimes going back to the questions help me solve it. Sometimes just writing down the question, and कभी-कभी वो अगले दिन भी चला जाता था. But it was better to do it this way for me, क्योंकि सिलेबस खत्म हो रहा था, rather than मैं वो ECG इलेक्ट्रिकल ऑल्टरेंस पे ही ढूंढी जा रही हूँ, सारा दिन खराब कर दिया, 2 ब्लॉक और कर सकती थी. मैंने ये किया, just write it down. And कभी-कभी you can like label the UL block, है ना, तो मैं लेबलिंग में क्वेश्चन डाल देती होती थी कि मैंने ये क्वेश्चन मिस करा है इसमें जो मुझे नहीं आता, जैसे 17th क्वेश्चन 20th क्वेश्चन मैंने उस लेवल में, तो कभी अगर मैं उस दिन नहीं भी उसको कर पाई, अगले दिन आई वुड सी क्यों इसमें से 17th and 20th क्वेश्चन आज रहता है एंड आई एम फ्रेश माइंडेड, उस दिन सॉल्व हो जाता है.
Anyone if has any questions, you guys can comment on this video and we'll try to answer those questions. And thank you so much, Avneet, for coming. And
anytime. Thank you for doing this.
Oh, thank you. So with this, just saying goodbye and have a good night. See ya.
You too.
Bye.